Good morning, everybody. It's good to have us here this morning. I welcome you all to today's session of our free webinar. It's been a long time coming. If you've been here, if you've been joining us so far since we started, you will know that we have our free webinars once in 2 months. We've had 4 sessions so far this year since May, and this is the last session for the year 2023. Okay, so and today the topic before us is diet modification for children with special needs. We have our facilitator in the house already and is ready to speak to us and to enlighten us this morning. I'll be reading out his profile right away. Mr. Oyebamiji Emmanuel Anoluwapo has his bachelor's degree in nutrition and dietetics from Federal University of Agriculture, Abeokuta, FNAB, and postgraduate degree in human nutrition from University of Ibadan, Nigeria. Anoluwapo is a registered member of Nutrition Society of Nigeria, Nutrition Society United Kingdom, International Society of Immunonutrition, Association of Nigeria Dietitians, and World Public Health Nutritionist Association. He started his career as a student dietitian with University College Hospital Ibadan, UCH. Thereafter, he had his dietitian internship at Obafemi Awolowo University Teaching Hospital, Ile-Ife, Osun State. He is a seasoned public health and registered dietitian. He's a nutritionist at University College Hospital Ibadan and currently a PhD candidate at KwaZulu-Natal University, South Africa, with a passion to solve health issues with pure nutrition. Furthermore, he is presently a freelance writer and radio presenter on several radio stations in Nigeria, namely Radio Nigeria, RCCG Radio, Pinnacle Health Radio, and Crown FM, and is the CEO of the first nutrition radio in Africa, Pure Dietetics Radio. I'm sure with this profile, you know that we have a great person before us this morning. Ladies and gentlemen, please let's welcome Mr. Oyebamiji this morning. Let me see that chat. Let me see your excitement in the chat session. Put in those emojis. Let's see you excited. Mr. Oyebamiji, you have the floor, sir. You're welcome. Yes.
Yes.
Okay, thank you, sir.
Yeah, can you hear me now?
Yes. Yes, okay. We can hear you, sir.
Yeah, sorry for the break in transmission. Yeah, so as every child in Nigeria or everybody in Nigeria actually have one disability or the other. That you can use your right hand and not your left hand is a disability in the place of those that actually can use their left hand. Why you can't use your left hand? So we should not see any child as a disabled child. They actually have one thing or the other that every one of us also are disabled of. So now let's talk about the special needs. Number one, we talk about physical needs, including chronic or terminal illness. That's children with muscular dystrophy, multiple sclerosis, chronic asthma, epilepsy, cystic fibrosis, cancer, and diabetes, other serious health issues. Hello? Hello? Can we all hear me right now? I think the...
Yes, sir, we can hear you.
Yes.
We can hear
you. Even diabetics, juvenile diabetics is an example of a physical needs, dietary needs of a child. Don't forget, everything starts from infancy when the mother is pregnant, so carrying the pregnancy of the baby. Then we have developmental needs. These are impairment like Down syndrome, intellectual disability, learning disability, autism spectrum disorder. autism spectrum disorder, attention deficit or hyperactivity disorder, ADHD, and other disorder related to neurological development. That means for anyone that has developmental needs or developmental the neurological development is low, it has to be with a problem with neurology. And how does this neurology actually step in? Number one, it starts from prolonged labor. Prolonged labor when the mother wants to deliver, malaria, chronic severe malaria or chronic malaria in pregnancy, uses of certain drugs, old age pregnancy. These are things that actually predispose one to all these special children. Then we have behavior or emotional needs. This include mental health needs such as anxiety disorder, depression, reactive attachment disorder, post-traumatic stress, acute stress disorder, and we have others because of our time. Then we have sensory needs. We have to do with sensory impairments such as visual impairments, blindness, auditory impairment, and deafness. So this actually prevents people from getting what is needed. So for us to actually manage this well, we need to look into their diets. What benefit of special diets for children? What we consume can influence how our brain and bodies function. It should come as no surprise that many parents look to special diets as a way of improving their children's health, behavior, and quality of life. So you bear me witness that after 6 months, when our parents actually want to upgrade us from breast milk to family food, and you are not getting the food, they will be telling everybody, oh, mommy, oh my God, this my child actually is not getting food. What should I do? So many children with special needs also have dietary issues such as constipation, diarrhea, lactose intolerance, gastroesophageal reflux disease, celiac, and other concerns. Knowing where to start is the key to the successful implementation of a new diet protocol. It's not that those children can actually not take the food, but when should we actually start the food? Which kind of food should we actually present to them? Don't forget, different special needs have their own special diets. Different special needs have their own special diets. However, choosing which diet is best for your child is the first step. With so many special diets available today, Parenting Special Needs magazine, which I work with, decided to provide full information on the most common option. The information provided here is not endorsed. So I want us to see this as what we've been practicing. So let's go to the diet. So diet for special needs children. When a child is diagnosed with special needs, it is natural for parents to start looking for what to improve their child quality of life. Diet is one area that can be modified relatively, especially something dietary changes are necessary due to allergies or celiac disease, and sometimes families choose a new diet for overall impairments of their health. Now let's go to the special needs. Let's go to the special needs and special diets. The number one topic or diet we'll be discussing about is gluten-free diets. Gluten-free diet, you might have been hearing the diet, they will tell you, this is a special diet. Yeah, no, this is not a special diet. Actually, a lot of us consume the diet without knowing that it's gluten-free diet. So gluten-free diet is used in treating celiac disease, a digestive disorder caused by an immune reaction to gluten. When the body is unable to digest gluten, such people also avoid gluten to improve their health, other health problems, such as rheumatoid arthritis. Gluten is a protein found in wheat. It's a protein that we find in wheat, in barley, in rail, and it is also found in oatmeal that is processed with wheat. That means whenever you have a child, that you are to manage with gluten-free diet. Even semo, our noodles, our spag should not actually be given to them because they are processed food from wheat. Some are from oats. And then another diet we'll talk about is gluten-free, casein-free diet. Gluten-free, casein-free diet. We call it GFCF diet, also known as autism diet. Require the elimination of two proteins from the person's diet. Gluten, which is present in wheat, rye, barley, and casein, which is present in milk and dairy products. The hypothesis behind this practice is that some autistic behavior are caused by digestive problem. So for these children to not to have this reaction, not to have effect of this on their health, we need to prevent the consumption of these two proteins. What are the proteins? We talk about the gluten and casein. We talk about the gluten and casein. The hypothesis behind this is the practice that some autistic behavior are caused by digestive problems, and these proteins are the two most difficult to digest with harmful byproducts in the digestive tract in our GIT. It must be noted that this diet is still controversial, but some people will tell you, you can try it, you cannot try it. But looking at it, the placebo to control is actually okay. But looking at the human being, it has not been proven. It has not been proven that we should continue using it, but it has actually been working for some people. Now we talk about specific carbohydrate diets, SCD. SCD was originated and developed as another treatment for celiac disease. Now it is also used as treatment of Crohn's disease or ulcerative colitis and IBS. These are also digestive problems that frequently occur with autism and other developmental disability. So you just look at a certain carbohydrate that your child reacts to. Whenever you consume, now I've managed an autistic patient, and when the patient consumes a lot of food, but whenever the child consumes beverages, the way in which the child reacts, the hyperactiveness of the child increases. And the hyperactiveness of the child increases. And the child will withdraw himself firstly, and after getting himself, the rate at which it will, the way in which the child will react, we will look at it, but this is someone that is actually keeping to himself before the parent actually know that it was the food that he consumed. And don't forget, the way in which the food is being digested, or the way in which the food is being processed or absorbed in our body system differs. Some are faster, the rate of catabolism in some people are faster, while in some it is slow. So SCD eliminates all grains, all lactose, the sugar that occur naturally in milk and dairy products, and all sucrose. The sugar is most in other food. What is allowed? We allow egg, we allow meat, fruits, vegetable, nuts, and legumes. Then there is another diet called GAPS diet. GAPS diet, not GT GAPS, but GAPS diet. We call it gut and psychology syndrome. Gut and psychology syndrome, which the name is derived from the book Gut and Psychology Syndrome by Dr. Natasha Campbell. This diet is ever more restrictive than SCD. Many legumes are banned from this diet, in addition to potato and yam. So also advocate the use of probiotics. So we can actually use probiotics, the beneficial bacteria that colonize the human intestine. In the private practice of Dr. Campbell, has noticed a clear connection between digestive problem and neurological or psychology problem. Don't forget, I made mention of that before. So this diet is a treatment for those interconnected health issue. Interconnected health issue. So looking at the, we talk about specific carbohydrate diet. So after removing this specific carbohydrate diet, and if you are not talking about GAPS diet, you need to add some vegetables and some legumes to eat. So we need to restrict the patient from taking some tubers, potato and yam specifically. And a lot of patients have been partaking it and they are getting well. Then we have what is called body ecology diet. Body ecology diet. Body ecology diet continue with the idea of recolonizing the beneficial bacteria in the intestine. Don't forget the word GAPS diet talks about prebiotics in the intestine. So now body ecology diets actually talk about continue the idea of recolonizing the beneficial bacteria in the intestine. The body ecology diet aims to treat many types of health problems and behavioral problems by including more of probiotics food and reducing the amount of sugar consumed. And where can we get our probiotics food? We can get it from our yogurts. Coconut coffee is an example of a food with live bacteria culture that is recommended for these diets. But I'm not sure we can get this coconut. I've seen it in Abuja, but I'm not sure. Okay, I've seen it in Abuja, I've seen it in Lagos, but I'm not sure it's available everywhere in Nigeria. But you can actually look at our non-sweetened yogurts as probiotics, live bacteria that can actually help in managing this. This kind of diet, we also use it in the management of diarrhea. In the management of diarrhea, when you have a child that is having diarrhea, vomiting and having a loose stool, we actually still use this kind of diet in managing. Then we talk about Fingold diet. This diet is named for a physician who studied the connection between diet and behavior, starting in 1960s. He found that behavior and attention improve when artificial color, flavor, sweetener, and preservative were removed completely from the person's diet. He also found that behavior improved when aspirin and food containing salicylates are removed. And a lot of us can bear me witness here that some of us actually react to some food that has artificial flavor or sweeteners or preservative. Some people will tell you, I can't eat this food because of the preservative. Yes, the person is actually reacting to it. And if this is not actually managed, this can lead to something else. And then the next one is ketogenic diet. Yes, a lot of us have heard about ketogenic diets. And what is ketogenic diet? What actually do we use ketogenic diet for? Some people will tell you, I use ketogenic diet for management of my weight, to reduce weight. Yes, it helps in reducing weight, but those using this kind of diet for reducing weight actually are doing their body harm than the good. And I will shock us that ketogenic diet is used in management of seizure and epilepsies in the clinical settings. Yes, you hear me right. Seizure and epilepsies. It is well studied, supported by 80 years of research and clinical practice, but it is intended only as a last resort to treat seizure. Even near what I said, as a last resort to treat seizure, and should be pressured under the direction of a dietitian. This diet minimizes the amount of sugar consumed and maximize the amount of fat consumed, because when the human body burns fat for energy, seizure activity in the brain is significantly reduced or eliminated. 80% of the calorie in this diet comes from fats. Yes, 80% comes from fats, but this restrictive diet lack many key vitamins, so supplement must be prescribed. And that is why we said it must be prescribed and managed under the direction of a dietitian, because of the supplements and vitamin that will be needed in the management. Then we talk about yeast-free and sugar-free diets. Yeast-free and sugar-free diets. This is still also a controversial topic. A few physicians link chronic yeast infection, bloating, and even psychiatric syndrome or symptom with yeast overgrowth in the digestive tract. Since yeast feed on sugar, a diet free of yeast must also be free of sugar. So if this is actually done, we will be able to control such psychiatric problem or psychiatric syndrome with yeast or overgrowth in the digestive tract. Then we talk about raw food diets. When food is cooked above 116 degrees Fahrenheit, naturally occurring enzymes are destroyed. So most of the vitamins are destroyed too. Raw foods such as fruits, vegetables, legumes, nuts, grains containing all the naturally occurring enzymes and vitamins, which means improving digestion and absorption of nutrients. A lot of us, when managing these special children, we overcook our food. And with this, the food that the nutrient that is needed to help them in controlling their neurological problem are easily destroyed by it. And that's why for some we recommend fruits, vegetables, legumes for some of them, because this nutrient, this vitamin, this enzyme actually help in the growth. And your amala cannot provide them vitamin. Your amala, by your yam, your rice cannot provide them mineral that is needed. They can only get this from your vegetable, your fruits, your grains, your legumes, your nuts. So we should not overcook it. Then lastly, we'll talk about whole food diets. Whole food diets are defined as food that are unprocessed and unrefined before being consumed, such as fruits, vegetables, whole grains, and meats. Most psychiatrists, physicians, and dietitians agree that the main benefit of any special diet is the elimination and reduction of bleached flour, refined sugar, artificial flavor, and color and preservative and processed prepacked food. In other words, a more natural diet usually leads to health improvements. In other words, we are telling us that for us to actually gain, but to manage this one, natural food is expected. Natural food help in improving health status. Even a lot of them that are having neurological problem, there is a specific food that they will actually love eating. There will be a specific food that they will naturally love eating. And what are these food is another thing that I and you need to actually identify. When you identify this food that they love consuming, let's encourage them to actually consume this food. And with that, we'll be able to provide them the nutrients needed for their health. Thank you very much. Over to you, Ma.
Wow. Thank you so much, sir. Hello. Can you hear me? Hello, can anybody hear me?
Yes.
All right. Thank you so much, sir, for the presentation, and I believe we have learned so much from that already. Miss Sulu is unavoidably absent right now, so I have to stand in for her. She's currently in another meeting where she's speaking right now. All right. So I, I believe we have learned so much from this already, and it's time to have our questions. In case you have any question for the speaker, please can we just go ahead? You can unmute yourself and then let us know what question you want to ask, please.
Okay, good.
So we really appreciate you, sir.
Can I ask my question? Good morning.
All right,
Yes,
ma. All
good
right, ma.
morning. You can go
I
ahead,
hope.
man.
Sorry, please.
Okay.
Okay, go
Okay.
ahead, ma.
Good morning. Please, I would like to speak to a special discussion with a parent. You think the parents have not been given the right nutrition, the right kind of food to the child. How do you introduce this kind of discussion to a parent without, how parents are? They want to like give you this. They always want to sound like, are you trying to tell me what to feed my child? Are you going to provide the money for it and so on? How do you do that without, the school also finding a fault with you for telling a parent what to give the child? Thank you.
Yeah, thank you, ma, for that question. Number one, as a dietitian, we don't advocate for foreign food. We advocate for our Nigeria-made food that is available in your locality. So now, and when we talk about it, so when we are discussing with the children or the mother, you tell the mother there is actually a specific food that the child love eating. There is a food that the child love consuming. If the child will, even if the child is having neurology problem, the child will tell you, the way the child position will react to you, will let you know this child actually love this food. They can consume the food more than 3 times a day. So what is needed is just to modify the food, add what the nutrient that is available that the child is actually in need of, add it to this food, and this will actually complement what the child is in need of. I don't know whether I've answered the question.
Yes. I mean, how to talk to okay, I get what you're saying. Some of them want to okay, today the child comes in with spaghetti, the next day the child comes in with this, the child comes in with Indomie and so on. And some of those are heavy food. Like I have a child that can stay for days without taking water. And he also goes days without going to the toilet. The only time he can actually go to the toilet if when he is well pressed, as he's trying to ease himself, the toilet just jumps out. Do you understand? He doesn't have control over going to the toilet and doing it properly. So in a case like that, how do you talk to the parents? What do you think? I just don't know. How do you tell the parents, see what I've noticed and see what you can do about it? Thank you.
Yeah. I think number one is in clinical, there's the question we do ask: how, when, where. If that question can actually be answered by the physician or the dietitian, by the mother, let the mother see that what the child is actually passing through is a disease condition that can be managed. Let them know how it can be managed. Let them know, see the consequence, and let them have the knowledge that this thing, if you actually help the child to manage it now, in future, they don't need. A lot of them have to be getting pampers for a child of 10 years. But if you can able to manage it right now, it will save them of their cost and also improve the health outcome of their child. I don't know whether I've answered the question. Hello? Hello? I don't know if I've answered the question, ma.
Hello.
Yes, we can hear you.
Hello, good morning. Can I speak, please?
Yes, you can go on.